But the concern, I guess, Doctor, is that it seems so basic. What do you do, and how do you transport contaminated material? So when that is the first thing that slips up in the only known case, that is when people think, do they really have a handle on this?
The bottom line here in Dallas is contact tracing. That's how we're going to stop the outbreak in its tracks, making sure that every person who had contact with the individual when he might have been infectious is monitored every day for 21 days, and if they develop fever, to immediately isolate them. That's how we break the chain of transmission, and that's what's going to make sure that we don't have a large outbreak in Dallas or elsewhere in the U.S. But we remain deeply concerned about what's happening in Africa, not only because of Africa, but because the longer it goes on there, the more it might spread to other countries and the greater the risk to us. So realistically, we all want to get to zero risk for the U.S., and our top priority is to work 24/7 to protect Americans from threats. We can only do that by making sure that we get it under control in Africa, and we're beginning to see the response ramping up there, but it's going to be a long, hard fight.
It is that, and one of the things that we're learning now, and we learned this week, was that it will take several weeks for U.S. troops. So the President has ordered, I think, up to 4,000. They've only been able to get a handful there because of some transportation problems, etc. Was the West late to this epidemic in Western Africa, and do you see any break in this, or does the problem continue to mount in the three major affected countries?
We're definitely scaling up the response. We're seeing a more rapid, more effective response in different areas geographically of the countries, and also in different aspects of the response. But it's going to take time. The virus is spreading so fast that it's hard to keep up. That's why it's terrific that the President has deployed the Department of Defense there in support of the disease control efforts. This is exactly what's needed, and it's going to make a difference, but it's going to take time.
Well, why was the world so late to this? This was, I guess, the first case was reported in March. I know you were over there and came home and rang the alarm bells, I think, in August sometime. It seems that the West, not just the United States, but the world was really slow to this.
I think this has been an enormous challenge. We've never seen an Ebola epidemic before in the world. It's spreading rapidly in urban areas between the three countries. This is a first time, and it really tells us that we need to ramp up our ability to find problems rapidly when they emerge, to stop them promptly, and to prevent them wherever possible. And that kind of core public health system, the laboratories, the disease detectives, the emergency response capacities, we need to make sure that we have those available in these countries and surrounding countries and anywhere there might be a threat. Because if we don't do that, ultimately, we're all going to be at higher risk.